Now earlier on we were trying to introduce the different types of investigations that you might actually want to do in gynecology and obstetrics. So the next one we should be looking at is wet mount microscopy. Wet mount microscopy. And the reason why we are doing this is to actually diagnose, okay, or confirm that there's a reproductive system infection. So what we have for this is, this is what a wet mount is, So let's describe what a wet mount is so that you can actually know what it is in literature. So it's a cost-effective diagnostic technique. It's used in gynecology to evaluate vaginal and reproductive tract infections. It allows the clinicians to observe live microorganisms, right, and cellular changes in real time. So it makes it especially very useful for identifying fungal infections, bacterial infections, protozoan infections, So what is a wet mount? You are trying to collect a sample of a vaginal discharge, okay? Then you place it on a glass with a drop of saline or potassium hydroxide, okay? You cover it with a cover slip. You examine it under a microscope to detect live organisms, the cells, and any abnormalities that is coming up, right? So this technique preserves the natural state of specimen. Do you understand? So it allows for immediate observation of motility, okay, and even morphology of the microorganism you are dealing with. So infections that could be diagnosed with wet mounts include things like trichomoniasis, bacterial vaginosis, candidiasis, atrophic vaginitis, inflammatory vaginitis. Now all of them, you could actually pause this video to check out the findings you possibly see on a wet mount. Okay, so advantages of wet mount is there's immediate results. You can check the organism in real time. Is not costly, all right, it's non-invasive, and it's very, very quick. Okay, so that's just it for the wet mount microscopy. And mostly are doing it its applications in diagnosing reproductive system infections.